Beverly Hills, land of the rich, home of the famous. Sure, the stereotypes exist, but what most people don't know is the truth behind the plastic. If there is anything I have learned in all my years as a plastic surgeon, it's that appearances are not always as they seem. I get patients from all over the world, from celebrities to the average everyday housewife. But there is one thing they all have in common. Everyone needs a lift. Welcome to my world.
I'm 18 years old. I'm from Glendale. I've wanted a rhinoplasty for more than 4 years because I don't like the bump on my nose, and I'm really excited to meet Dr. Kassabian to see my options.
The doctor's ready to see you. Want to come in with me?
Yes.
Good luck.
Thank you.
Hi Caroline, I'm Dr. Kassabian.
Hi, nice to meet you.
Welcome. What brings you in today?
Actually, I don't like the bump on my nose, and I was wondering if there's anything I could do about my eye bags.
As far as your eyes are concerned, you don't have eye bags. You just have a little bit of hollowness there. Just the position of your cheeks are lower. That's giving you the hollowness underneath. And I'll discuss how we can make that better. All right? Tell me about your nose. Did you fall as a child? Were you in an accident? Any history of trauma?
No, I just don't like the way it looks.
Okay. Do you have any difficulty breathing?
No.
All right. Well, what I want to do next is I'm going to assess your breathing, assess your septum and turbinate. We'll take some photos and then we'll discuss your plan. Okay?
Sounds good.
So what I found is your septum is slightly deviated to the left. So what I'm going to need is that as I'm making your nose smaller, it's important to fix your septum so that your breathing is as good as it could be. Okay, and at the same time your turbinates are big, so I'm going to shrink those down to assure that your airway is open and you're breathing properly. Okay, from the outside you have a cute nose, it's just that this small bump, you're going to shave the bump, and then the tip, it's a little bit droopy, needs to come up a little bit. Overall, you have a cute face and you're gonna have the cute nose to match it, all right?
All right.
And I see what you're talking about. Just the cheeks are in a lower position. That's just genetic. That's just how your mom, your aunts are. How we can make it better is two options. Either we can do fillers, but those last about 6 months to a year or so. Or we can do some fat injection, your own fat that's harvested, processed, and injected, and that will last much longer time because it's your own tissue, it's your own cells. Your body, once your blood vessels attached to it, it's going to be there for a long, long time. All right? I think the fat injection is the best option for you. It's a solution that's long lasting, and it will look good and minimal maintenance with that. All right, so both procedures could be done at the same time. Recovery time, you're looking at about a week. That's when the splint comes off. The fat injection, that's got like minimal swelling. Any questions for me?
Yeah, how long is it gonna take to like fully recover?
As far as the nose is concerned, you're gonna be swollen for about a couple of months initially. For it to get the final shape, it's going to improve over the next 2 years. It's going to shrink down more and more. But in 6 months, we'll have a good idea how it's going to look like. All right? So if you have no further questions, we'll go ahead and schedule your procedure.
Okay, sounds good. I finally met with Dr. Kassabian and I scheduled my appointment for my rhinoplasty. I can't wait to get the nose that I want.
Meet Joe, an active professional who's on his way to the top. And meet Jane. She's got it going on as well. Just like many of us, they exercise regularly and eat healthy. So what's the problem? That stubborn spare tire and muffin top just aren't coming off. Totally uncool. Well, there's a cool new solution. It's called Cool Sculpting, a patented, clinically proven, FDA-cleared safe procedure that freezes fat cells, but not your skin, so that they naturally go away. Yep, that means no needles, no knives, no downtime, and no worries. Developed by Harvard scientists and offered only by licensed physicians, innovative Cool Sculpting non-surgically targets those fat cells in your body that give you those stubborn lumps and bumps. And with a single visit, you can expect to see an undeniable reduction of fat in just 2 months. Best of all, you can come in during your lunch break, then head back to work in 1 to 2 hours. You've got nothing to lose. Well, except of course those unlovely love handles. Ask your physician for a consultation to see if Cool Sculpting is right for you. Find more information in a center near you at coolsculpting.com. Cool Sculpting. Reclaim the real you.
Morning. Hi, I'm Carla. I'm gonna be your nurse, okay?
Today is my surgery day. I'm very excited, but I'm also very nervous. I can't wait.
Good morning, Caroline.
Hello.
How are you?
Good, you?
Good, good. Today's the day.
Yeah.
Let's go over the plan.
Okay.
So, gonna fix your breathing first. Okay, straighten out the septum, the turbinectomy, those are the filters on the side, make them smaller. And then from the outside, shave the bump on your nose and then bring the tip up a little bit and make the nose a little bit less wide. Okay? Do you have any questions for me?
No.
Yeah? When you wake up, you're gonna have a splint on that stays in for a week. And then you'll have packing in for a few days, but you'll be able to breathe through that. Alright, surgery should take about an hour and a half. You should do very well.
Alright.
Okay? If you have no further questions, let's go ahead and get started. Alright?
Okay.
Okay. Take a deep breath. You're feeling more relaxed. Yes. Another deep breath. Where do you want to go? Dr. Gordon is going to take you. Getting ready to start Caroline's surgery. She's gonna undergo a rhinoplasty, which is 2 parts. First, fixing the breathing issues, and then the cosmetic issues. So surgery should take about an hour and a half, and she should do very well.
Meet Noelle. She's taking her little one for a stroll. Like a lot of new moms, she's frustrated with her figure and struggling with that last bit of baby bulge. Luckily, there's a non-surgical procedure that can help moms, or any woman, transform herself. It's called Cool Sculpting, developed by Harvard scientists and offered only by licensed physicians. Cool Sculpting's innovative, non-invasive technology freezes and naturally eliminates fat from the body. This breakthrough procedure can safely eliminate fat with no needles, no special diets, no exercise programs, and no downtime. Best of all, you can have the body you want without altering your entire lifestyle. Ask a Cool Sculpting provider for a consultation to see if Cool Sculpting is right for you. Transform yourself with Cool Sculpting.
I'm done with Caroline's surgery. Everything went very well. Not only she looks better, but she'll be able to breathe better. I'll see her in follow-up tomorrow.
It's been about 3 months after my surgery, and my recovery was actually very good. I didn't have a lot of pain, and it healed very fast. It was a great experience for me because it was my first surgery, and it made me overcome my fear of surgery because it wasn't that bad. I'm very glad I did the rhinoplasty because it improved my self-confidence and I feel so much better about myself now.
Hi!
Hi.
So great to see you.
You too.
You look fantastic.
Thank you.
I love what I'm seeing. Tell me, how's it going? It's 3 months now.
Yeah. I really love my nose. It's so natural and I love the outcome of it. Everyone compliments me for it.
Yeah, you're pretty to start with, but this complements your features very nicely. I like how it's proportional and how it makes your nice features stand out, like your eyes. I'm loving how everything came out, and how it fits together. Yeah.
Thank you.
What I want to do next is examine you and see how you're healing and take some photos, and we'll go from there. All right?
Okay. Thank you.
Well, it looks like everything's healing very well. I like how everything's looking. You're looking fantastic. Any questions, concerns?
Actually, I was wondering if I can wear sunglasses now.
Yeah, it's a little bit early, but if you have light sunglasses, then you can wear those. Very light sunglasses, not for long periods.
Okay.
All right?
All right.
Okay, then I'll see you in follow-up in 3 months, all right?
Okay.
So good to
Thank
see you.
so much. I'm very glad I did this before college because it was a new beginning for me and I felt very confident starting college off as a new person. Anyone who's considering doing this that is my age, I wouldn't hesitate. Thank you, Dr. Kassabian, you're the best.